Hello everyone, welcome to Patient Knowledge. I'm Dr. Kirmani and today I'm going to be talking about Parkinson's disease. So let's get started. What is Parkinson's disease? It's also known as shaking palsy. Parkinson's disease is due to an imbalance of chemicals in the nerve cells of brain that regulate movements. Now these cells do not fire smoothly and various body movements are affected. How common is the problem? About 1 in 1,000 people develop Parkinson's disease. It's seen mainly in elderly or in late middle age. However, some drugs, toxic fumes, or substances such as carbon monoxide and lead can also cause this disease. Let's look at the signs and symptoms of Parkinson's disease. People with Parkinson's will have stiff and slow movements, causing difficulties starting a movement. A shuffled walk, which is they're dragging their feet and there's loss of arm swing. They'll have an expressionless face and their speech is slow and flat. They'll have difficulty writing, a tremor, especially on hands and arms, with a pill rolling movement. Tremor is worse at rest and it tends to go away when an action such as picking up a pen is performed. There is no pain or numbness or pins and needles in this condition, but later on falls and trips may become a problem. What causes these symptoms? The problem is caused by the lack of a special chemical in the brain called dopamine, which the nerve cells need to fire. Now it's rather like the chemical in the battery gradually running out so that the battery becomes flat. Well, it's not caused by a brain tumor or a stroke, but in some cases, poor circulation can contribute to this problem. Let's look at the outlook. There are many different grades of severity, but many people have a mild problem and are able to cope with it, even without the need for any drugs. The good news is the disease progress is a very slow process and it's rare that a person gets severely disabled and confined to a wheelchair. If anyone develops Parkinson's disease after the age of 60, they may expect to live out their normal life expectancy. What are the risks? It's not a life-threatening disease, but it does not affect nerves that supply the heart or other vital organs. Well, the two common risks are frequent falls and mental depression. Let's look at the treatment. Self-help and medication are the two things that can be used for the treatment. Self-help is an important part of managing at home. The aim is to keep life as active as possible with the help of a caring family, friends, and other people around. Now, mobility can be assisted with walking sticks, bath rail supports, special banisters, and chairs with high seats and arms. It's important to have regular exercise, so stick to an everyday routine and make your life as active as possible. Your doctor should see you regularly to assess your progress and ask about special programs that teach how to improve your balance and coordination. Medication. There are no drugs that will cure the problem, but modern drugs will relieve the symptoms of stiffness and poor mobility. Dopamine-releasing drugs prescribed earlier, they are more beneficial. Drugs can have side effects such as nausea and dry mouth, so the doctor may have to juggle them according to your progress. That's all about Parkinson's disease. Hope it was useful. Thanks for listening. I'd love to hear any suggestions on what you might like to hear more about. If you like my video, like and subscribe to my channel. Bye for now.